Hello. Okay, we shall start in a minute. Oh, it started raining here outside. Okay, we have 11 students. Hello. Okay. Okay, let us start and I hope, good evening, I hope other students will join us during the lecture. Anyways, the lecture is recorded so they can listen anytime when it will be convenient and suitable for them. Okay, today we speak about violence and aggression from the point of view of public health, because these are topics which may be reviewed and discussed and interpreted during different points of view. Violence and aggression may be um, revised from the point of view of psychology, from the point of view of politology, from the point of view of sociology, or different biomedical sciences. We can study substances which are secreted in synapses during abnormal behavior, which may be characterized as violence or as aggression. So let us first discuss briefly, very generally, what is violence, what is aggression, and what is difference between them. And later let us speak about different sorts of violence and the role which public health may play in decreasing the level of violence and how to eliminate the violence from our society, which instruments we can use in order to eliminate the violence and in order to explain, to make it more explicit to populations that violence is not the correct and human way of behavior. So let us start from definitions. Aggression, let us start with aggression. Aggression is an evolutionary form of behavior. Evolutionally, to be aggressive is normal um, because it's chapter 9, because aggression forms a part of behavior of animals. To survive, they need to be aggressive to protect their territory, to find the food, to for multiplication, for everything. They need different types and different degrees of aggression. So we can say that aggression which we receive genetically from our ancestors, from people who lived in more wild conditions compared to today's conditions. Aggression is more or less normal and physiological form of behavior. Okay, so we may be aggressive to people which surrounds us, and somehow it's possible to explain what dictates us, which are the reasons which condition our aggression, our aggressive behavior. But in contrast to aggression, violence is human invention. So normally animals are never violent to each other. only humans start experiencing violence as a special mode of behavior, as a special sort of behavior. So, and what does it mean, and what is the difference between these two conditions? If on Monday I'm aggressive and on Tuesday I'm violent, what is the difference here? The difference is that aggression is needed to survive, but violence is a behavior which is not needed for survival. That's why we say that being violent means abnormal and non-physiological behavior. The main definition of violence is that when someone is violent to another person, it means that someone starts feeling pleasure when another person suffers. So when I see you suffering, I start feeling pleasure, and this is called violence. Maybe I'm realizing it, maybe not. But most important thing is that I'm intentionally making you suffer. Someone intentionally creates conditions, intentionally creates conditions to make another people start suffering and receives pleasure, experience pleasure from this suffering, from observing this suffer. So this is the main contrast, the main peculiarity which distinguishes violence from aggression. So aggression is needed to survive. It's not an intentional action. It's a reflexive act. I do not realize that I intentionally kill or harm another individual. Okay, this is aggression. But violence is when I decide that I have to be violent in order to be happy. Okay, so this is main difference. I see you suffering and I start experiencing pleasure because you suffer. But nothing changed in my life without this. So I don't need it to feel physically or morally better. I just need to see you suffering. So how violence is accepted in society and which are the different sorts of violence? First of all, let us distinguish interpersonal violence. What does it mean, interpersonal violence? It means violence between individuals. Okay? When professor or lecturer is violent to student or students start expressing some violence towards lecturer or professor. Another sort is when we have cases of family violence or domestic, so-called domestic violence. It means when we have victim and someone who is aggressor. For example, wife suffers from her husband because husband consumes a lot of high strong beverages in big amounts, and he cannot control his behavior, and he starts to be violent to her. Or the wife may be violent to husband, or parents may be violent to children, or child may be violent to mother. Different sorts of interpersonal violence. This is called interpersonal violence, when Intentionally, I'm making you suffer and I start experiencing pleasure from this condition when I see you suffering. Another sort is collective violence. Collective violence is when group of people are expressing intentionally more than aggression. For example, civil war, genocide, homicide, or deportation of nations, which was historically evident during 20th century, for example, before Second World War or during Second World War. Aggression to and violence expressed towards ethnic groups, different ethnic minorities. Okay, these are called collective violence. And one of the very usual form of collective violence is armed conflict and wars. Okay, so armed conflict historically, they are very frequent in countries with polyethnic population, when we have ethnical majority and ethnical minority, or when neighbor countries start experiencing violence due to some territory, due to some political disagreements, on some religious grounds or cultural grounds. These all are forms of collective violence, which in case of armed conflicts may be defined and denominated and called as wars. Okay, so one very interesting type of acquired violence is trauma or injury, when our amygdala or prefrontal cortex, these two regions, are controlling our aggression physiologically and evolutionary. And if after surgical treatment or after injury, for example, car accident, we have some pathological changes in amygdala or in prefrontal cortex, patient can start lost controlling himself or herself and experience aggression and violence to people who are around him. So you see, trauma or injury may be very important etiological factor in case of violence. Violence also may be symptom of different abnormalities of psychological types. For example, some psychiatric disorders, stress. Stress may be of different sort. Stress may be due to a lot of factors. Stress may be due to sad love stories. Stress may be due to death of some people, some persons who we love. Stress may be due to unsuccessful career, or stress may be due to illness. For example, patients with chronic pain, and chronic pain may be conditioned by different factors. For example, chronic pain may be accompanied symptom of cancer, on the last stages, on the third stage, on the fourth stage of cancer, when we have bone pain. So some patients are depressed, and others start expressing violence. They are violent to their family members, they are violent to hospital personnel, they are violent to people who they love. So stress is one of the main determinants of abnormal behavior. When people say that, I am observing some changes in his or in patients or in my colleagues' behavior. He's speaking very loudly. He's very aggressive to his colleagues, and maybe something happens in his life, and maybe he needs some professional help. So you see, different factors can condition the appearance of violence. And trauma of childhood, trauma in the later period of individual development. Trauma is also one of the risk factors of abnormal behavior and violence. People who live in conflict regions, where, for example, civil wars are repeated with some frequency. For example, there are regions in different countries, on different continents, where civil wars are continued and repeated. And people who live in this permanent ambience of stress, fear, people who are in need, who do not have education, who suffer from different diseases and have no health system assessment and management, when there is no public health system in many countries around the world, these people cannot feel that they are protected, and this permanent fear can be unconsciously transformed into violent behavior. And fear and stress are two main factors of which form basis of violent behavior. So we can say that trauma and memory of this trauma plays a crucial role in the formation of violent behavior. Trauma may not be repeated, but trauma may stay in our memory during years and years. And some people live with this trauma. They can't forget it. In these cases, we speak about post-memory. Post-memory is a term which was coined by Professor Mariana Hirsch from Columbia University. And with the term post-memory, Mariana Hirsch wanted to highlight, to underline the traumatic experience of generation, which shares this experience with their following generations. For example, my grandfather suffered from Holocaust. He was prisoner in the concentration camp. He survived. And now imagine that in private conversations, he's sharing his experience with his son, and my father then transmits to me my grandfather's memories of traumatic origin. So what happens here is that post-memory is a sort of memory, mainly of traumatic origin, and with trauma lives not only the person who suffered, who witnessed this traumatic ambience, but also his following generations without being witnessing this traumatic ambience, without living in those traumatic conditions. So past memory comes to us in forms of narrative, mostly, in forms of diaries, letters, in form of literary texts or historical documents. And we receive this information from the first hands, which are, of course, by their nature subjective, because how I accept the reality which surrounds me and how you accept the same reality which surrounds us may differ. Our reception of reality may differ, and this is normal. So, at the same time, together with subjectivity, this reality may be hyperbolized, exaggerated. And why this reality would be exaggerated? Because when time goes on, for example, I was prisoner of the concentration camp 20 years ago, and 20 years have passed from that time. I start forgetting something, maybe. Or maybe something seems to me more barbarian, more abnormal, and I am adding something, my personal experience, to the facts which happen in reality. So you see, this stress which I have experienced in the concentration camp is forming my behavior, which will be, as I have already mentioned, either depressive for me, and I will try not to communicate with a lot of people. I would hate to be in the center of the company. I would like to forget about the past and not to meet people who were prisoners of the same concentration camp and who also survived. Or I will not be depressed and I will become aggressive. I will be more irritated, and I would think that I deserve more because I suffered. So these are different ways of acceptance the reality and acceptance of past, and how past transforms my reality, my present. So you see, different factors condition, and one of them is, as we have mentioned, just spoken, is trauma. So in case of trauma, what is most important is not only treatment, but rehabilitation. Because after the process of rehabilitation, if this process is successful for me, I may start forgetting and erasing from my memory the negative experience in order to survive psychologically, to survive socially, again to be part of the society, and not only passive part of society, but to be active citizen okay, to participate in social projects, to have lectures, to deliver lectures, to communicate with colleagues. And for this is very important my psychological post-traumatic rehabilitation. Okay? And different factors play a crucial role in rehabilitation. It may happen that in my process of rehabilitation, I'm very progressive. I start forgetting something, but one day, some concrete reason, conditions, the backup, the remembering. For example, I had very positive follow-up after my process of rehabilitation, and one day walking in the street, I accidentally meet a man who was in the same concentration camp, and everything comes again. And it starts invading me and remembering me, all misfortune, all tragedy, all pain, all stress which I suffered in the concentration camp. You know? That's why we say that, first of all, rehabilitation, successful rehabilitation is very individual. It's due to each patient. How ready is patient to pass this barrier? How many strengths can possess this patient in order to go through this? Not to stop in the middle of the way, to continue walking and to start forgetting. So these are main sorts of violent behavior. In different countries, we have different statistics. And the main idea of epidemiological research is to find out the main factors which determine different types of violence. For example, if in countries of Caucasus we have high incidence of domestic violence, how can we explain this? Which may be cultural or religious or alimentary or dietary peculiarities should be taken into consideration to explain, for example, why in Georgia, and unfortunately we have very high degree of very high incidence of family violence, and mostly the victims are wives and children. So the main goal of epidemiological studies is to try find out why this happens and how to eradicate the main reason or reasons which condition this violent behavior. And in all countries, in all regions, we have epidemiological data which indicates that, for example, in Afghanistan, we have high incidence of interpersonal violence or collective violence. Or in the United States, we have frequent cases of domestic violence, and how to explain this. And the researchers, they are distinguishing and grouping the reasons into different groups. And they are also, after detecting reasons, they are suggesting the concrete recommendations how to eliminate this violent behavior. And mostly, in most of cases, they agree on the point that the main instrument for preventing violent behavior, the main key for helping people to understand that they have rights is, how do you think, which is this instrument? This instrument is education. So mostly the regions or countries which suffer from, for example, interpersonal violence. Now I'm speaking more about interpersonal violence. These are countries with low income or middle income countries where education as a system, as part of public health, because you remember that one of the main functions of public health is to educate society. So when education is not developed as a system which forms our everyday life, we can say that these societies suffer from interpersonal violence. And in this case, one of the main approaches to solve the problem, to, on the first stage, to decrease the incidence and then try to eliminate, not to have the cases, to prevent it, is to organize continuous TV shows, seminars, talks, conferences. You know, it's like publicity. When we watch TV or we have advertisement of Coca-Cola, that we say that we hear permanently that it's the best beverage, we should drink Coca-Cola, Coca-Cola, and it's good with all sort of food. We hear it continuously, and that's why bigger part of populations, they drink Coca-Cola. The same happens with education. Education should be like Coca-Cola. We should speak about it permanently, continuously, because coming generations, they need to understand that they have right to be respected and they have right to be healthy and not to experience other people's aggression, because it damages them not only physically but also psychologically, also morally. And you know, when some studies discovered that self-esteem of children from families where domestic violence was normal behavior, the self-esteem of these children was quite low because they could not find strength inside themselves to be sure that they can do something independently. And these people were quite unsuccessful during their career development, during their studies, in their personal life. And somehow domestic violence was accepted by them, by victims, as normal behavior in family. So mostly people who is violent to another people, they have some fear of something, or they are victims of violence during their childhood or adolescence. And these people are never happy because they live in condition of permanent fear and they don't know how to survive. And violence is their shelter. They are escaping from reality. They are violent And by this way, they are escaping from reality. They are escaping from difficulties. And you know, life is full of difficulties, full of economic difficulties, full of moral responsibility. And being violent may help me to escape from moral responsibility. For example, I'm responsible for my family, for their well-being, for their economical well-being, for their educational well-being. And if I will be violent, I may escape from this responsibility. I may forget it. So that's why epidemiological studies, which are conducted in this direction, in order to find out the main and very main reasons of domestic or other sorts of violence, mostly they demonstrate the studies that people who are violent, they were in past they were victims. And the only instrument is psychotherapy to help these people and education of their family members, that they have a right to be respected. In case of collective violence, we have a little bit different situation, because mostly collective violence, for example, genocides or homicides or different sorts of elimination of people or group of people, this sort of violence is dictated by political reasons, by social tension, by economical factors, by fluctuation in the development of society. You know, we cannot distinguish and say that this violent behavior observed in a concrete country is only due to economical or demographical or public health or another reasons. Mostly the situation is very complex and multifactorial. For example, economical problems, social problems, maybe also called political problems, or educational problem, maybe also called, or religion problems. Education and religions, they may be called social problem. So what I want to say is that never mind which is the concrete reason in concrete context, in concrete historical context, in concrete time context, what is most important to see which factors determine the appearance of this reason in order to eliminate the factors, and the reason will disappear automatically. Okay, so that's why epidemiological studies and statistics gives us very strong educational background. Violent behavior is also very related to some mental disorders or invalid mental behavior. For example, people who decide to suicide themselves, they also may be violent. They may be depressive or violent. It's very individual acceptance of reality. But in both cases, either when I'm depressive or when I'm violent, I'm trying to escape from reality. I'm trying to disappear. And as it is impossible to disappear, because difficulties do not disappear if we do not solve them. Okay? They are waiting to us to be solved. So the problem is that moral responsibility of society members is to help people whom we see that they are in need. They are in need, for example, economically. A lot of crimes are committed based on social grounds. When people are not materially so strong to support their families, they decide some to transform into criminals in order to let their children survive, in order to have some income. And all the economical abnormalities which take place in different countries in periods of transitions. What does it mean, periods of transitions? When we have, for example, non-democratic government, and after some years, after a couple of years, we have democratic government, and we have this 2-year period of transition. And during these 2 years, a lot of very sad things may happen. And they will be determined by social difficulties, by economical problems. The same happens in the healthcare systems. As we already know, public health as a system is a luxury for a lot of countries, because to finance public health you need a lot of money. To elaborate, implement, and later to observe how effective were public health projects, you need a lot of money. To synthesize new medication or to create a vaccine, you need a lot of money. And not all countries, even in the West, not all countries can let themselves have very well developed public health system. For example, this pandemic situation which we are observing today, if we speak about the United States, for example, we see how difficult for the hospital sector in the United States was this pandemic, that the hospitals were overloaded by patients. Departments of emergency or intensive care were overloaded with COVID-infected patients with complications, and a lot of doctors were infected. And this is United States, where medicine is developed perfectly. And now imagine in other countries where public health as a system doesn't exist. How can they manage the situation? So what I want to say is that every case is individual. Every behavior is very peculiar. Tomorrow my behavior may differ from my yesterday's behavior. Maybe the factors which determine my behavior differ or be same, but what plays here a crucial role is concrete context in which I respond to factor which is irritating me, both in positive sense of this irritation of this word and in negative sense. In positive sense, irritation means a stimulus, motor, which makes me act to change something around me. In negative sense, irritation means destructive behavior, which is negative for me anyway, and in some way for people to whom my violence is directed. But for me anyway, it will be destructive. Anyway, Even the stress, when it is positive, we call it eustress. Even the positive stress is destructive for the health. It's very interesting. Selye was the professor who studied the phenomenon of stress. He was one of the first and very famous. And he called eustress to positive stress. And he said that stress, never mind is it positive or negative, is stress. And some morphological changes takes place in our different tissues. And besides of taking place in concrete period of time, besides this, our memory memorizes them. And we don't know how it will be interpreted later. And what will be the fruits, the products of this even positive stress. Or positive and negative, it may be our individual estimation. We may estimate something as negative when it happens today, and it's stressful for us. But after a couple of years, we see that mostly this phenomena was positive for us. For example, I lost my job. 2 years I suffered, but after 2 years I have found better paid job where my salary is 3, 4, or 5 times higher. So it means that from my personal development, for my career development, for my income, that stress was absolutely positive. Otherwise, I wouldn't started looking for a new job. So you see, it's important how you estimate the stress in concrete context, because in another context or from another point of view or after some time, you may estimate as in an opposite way, being positive or negative. Okay? So this was what I wanted briefly to explain, just to distinguish aggression from violence, being one physiological and another invention of human beings. Also to detect some sorts of violence, some domestic or family violence. In different literature you will read some authors call it family violence and others call domestic. The idea is the same. Also some collective violence, wars, armed conflicts. So this lecture I hope will serve as an introduction for you, introduction to the textbook. Okay, this is the second part of chapter 9 as far as I remember. So please start reading it. Okay, this is very interesting chapter because it is very strongly interconnected and related with different disciplines, with demography, with politics, with philosophy, with economy, because economical factors play here huge role and crucial role. And that's why we say that public health is a discipline which is connected to all, not only biomedical, but social sciences, but with social sciences, because we are not only physiological animals, we are also metaphysical beings, right? We have our spirit, we have our philosophy, we have our psychology. So some part of our behavior is studied by social sciences and is analyzed by using methodology of social sciences. Some quantitative research, qualitative research, or mixed methodology research. So that's why we say that, for example, interviewing people, asking them some psychological questions, may be very helpful to determine their health condition. That's why we say that public health is very closely related not only to biomedical sciences, but to social sciences, to humanities, to philosophy, and to different sciences. So please read several times and carefully these chapters, because this chapter will help you not only to pass this subject, but it will help you to form your thinking, to form your ideas, which you will use during the whole life, during your professional career and your everyday life. Because in 20th century, we have observed very high incidence of violent behaviors. And I think that unfortunately, 21st century will not be the exception. And maybe it will be the sad but logical continuation of the violent 20th century. So for you, as for doctors and as for active citizens, which form part of civic society, to understand in depth the idea of aggression, of violence, of conflict will be very helpful for your development, both professional and individual. So that was all what I wanted to tell you. I hope it was interesting for you. So it's a pity that we have only 12 students, but what can we do? And now please write to me or ask me if you have any questions concerning these topics. Any questions? I tried. Thank you. You know, these questions are assessed from different disciplines. So I enjoy reading philosophy, I enjoy reading political texts, and I'm making my notes, which I use later for my research. And you know, our memory is composed in a way that we remember some things. We don't realize everything. We don't have it in active memory, but when it comes, when it becomes necessary, they appear in our memory, and that's why I would advise you to read a lot. We have questions here. Is there any question banks to practice and for better understanding? No, we don't have sample questions, if you mean this. When you will write your first midterm, your second midterm will be easier because the structure of the questions is the same. And as you already know, we never include statistics and formulas in the midterm. So we just include very main definitions and very key concepts. So it will not be difficult. But what will make me happy is that to keep in your memory some things of public health after you finish studying public health, and to make public health some part of your everyday life. It will make me really happy. I will decide that I spend this time with productively, and somehow I help other people when I share with them something what I have read. Any other questions? How many questions will there be in the midterm? 30. 30 questions. So we have 30 and 40 for final. So if you ask me about second midterm, it will be 30. And the structure is the same. It's MCQ and true and false. Thank you. Any other questions? No questions. Okay. Thank you for joining. And I hope to have possibility to meet you next Monday at 9 p.m. Thank you very much. Bye. And be healthy.